start. Helen and I are really thrilled to be here. We're really grateful for the opportunity to talk about a subject that's really close to our hearts. We first gave this talk last year at the Prison Service Perrie Lectures, and we're really pleased to have the chance to revisit this topic. Both Helen and I are psychologists. So Helen is a research psychologist, I'm a forensic psychologist. We both spent over 20 years working for the prison service before we left to set up Knowledge to Action, which aims to use evidence to improve outcomes and experiences in the criminal justice system. And during our time in the service and in the last 2 years, we've visited countless prisons. We've met, we've worked alongside, we've conducted research with a huge number of staff, and we've seen firsthand the incredible work that prison staff do, as well as the really challenging environment that they face day after day. We know that prisons are a high threat environment, so staff have relatively little control over what can be an unpredictable, a dangerous workplace. Prison officers regularly see and deal with difficult, emotional, threatening, dangerous situations. Some people get hurt physically, some incur psychological injuries. And first and foremost, we have a moral duty to protect the well-being of people working in prison. But that has secondary benefits as well, because by paying attention to well-being, we help to retain talented people in the service. We enable people to do their best. We know that poorer well-being is linked to higher rates of sickness, to lower rates of retention, poorer performance. Our decision-making, our general competence is affected by stress. So if we want a stable and well-performing workforce of prison staff, then we really need to focus on well-being. So in this session, we're going to start by defining what it means to take an evidence-based approach to well-being before we move on to talk about the major influences to the well-being of prison staff and the strategies that we can use to make a difference. We then want to have some time to hear from you about some of the key barriers and enablers to support for staff in prisons before we set out some final thoughts. But before we do that, we just wanted to talk about what we mean by well-being. There isn't one agreed definition of this term, but we're using well-being as defined in the 2014 Care Act, which encompasses several areas of life. So that includes personal dignity, contribution to society. So that includes participation in work, training or education. Well-being encompasses physical health, mental health, social, domestic, family, economic health, but also protection from abuse and neglect, control over day-to-day life, and having suitable living conditions.
Okay, so how do we take an evidence-based approach to these issues, to the issue of well-being of staff? We're really committed to promoting and supporting evidence-based practice. And what we mean by evidence-based practice is the conscientious, explicit and judicious use of the best available evidence when making decisions. And the model presented here, which you might be familiar with, suggests that there are 4 different or main sources that we should look at that are evidence when we're looking at an issue or when deciding what we should do in response to that issue. And these 4 areas are firstly scientific research, so that is the objective research, quantitative and qualitative evaluations and scientific reviews. The second area is professional expertise, so that is including the experts in the field. The third is around stakeholder knowledge, which relates to staff and managers and service users. And the final area is organisational data. So that's audit and performance data, but also the policies that we kind of use. And evidence-based practice is a really important goal for any organisation. Using evidence-based practice can result in significant benefits for organisations or services. So firstly, it helps us, using evidence-based practice can really help us to improve our chances of impacting positive outcomes. It can also help us use scant money and resources more wisely, and to ensure that organisations, prisons and so on continue to learn and grow. So in preparing for this talk, we've applied this model, so these 4 areas of evidence-based approach to the well-being of prison staff.
So using those 4 types of evidence, what factors influence the well-being of prison staff? Well, the scientific research has sort of broad agreement that there are key work-related stressors which affect well-being at work for those in critical occupations. So critical occupations are characterised by regular exposure to emotionally charged, high-threat situations. So people in critical occupations include emergency service workers, disaster responders, people in the military, and people who work in prisons. And we see these 4 stressors here in other types of evidence too, not just in the scientific research, but including the accounts of prison officers' experiences here in England and Wales, in the accounts of key stakeholders. So, for example, prison managers identify stressors in each of these categories as impactful on the well-being of prison staff. We also see these factors in organisational data, like exit surveys, like the Civil Service-wide People Survey, as well as in the national and international research with people working in prisons. And that means that there's a triangulation of evidence that tells us that these factors are important. These make a difference to the well-being of prison staff. Now, there are also individual level factors that affect well-being. So personality traits like optimism or a tendency to ruminate, as well as social factors like the support network that people have outside of work, what's going on in their wider lives as well. But what we're focusing on here are the factors that are relating specifically to the workplace. So the first of these workplace-based sort of stressors is the environment, and specifically perceived exposure to threat or harm in the workplace. So there's strong evidence from studies across the world that how exposed people feel to threat makes a difference to the well-being of those in critical occupations. There's also some small-scale research outside of the UK to suggest that officers working with more dangerous prisoners, who are at the highest risk of assaulting officers, report the highest levels of stress, and that things like rates of substance misuse in jails affect how safe officers feel. The second group of stressors are task-related. So these are things that get in the way of or affect completion of job tasks. And they include things like time pressure, work overload, work complexity, interruptions. And research by the universities of Lincoln and Hull found that unrealistic expectations and heavy workloads were a key source of stress for prison managers. And research with frontline staff tells a similar story. Then we've got role stressors. So these comprise role overload, role conflict, and role ambiguity. Role overload is when you're wearing too many different hats. It becomes difficult to fulfill the expectations of all of them in the time that's available to you. Role ambiguity is when the boundaries and the expectations of your role aren't clearly defined, or maybe they're open to interpretation. Role conflict is when you hold one or more roles that pull you in different directions, that conflict with each other. And research with frontline prison staff tells us that balancing care and control and the conflict between maintaining security and working to rehabilitate people in prison can be really difficult. And international studies suggest that that's a key source of strain for prison officers in some other jurisdictions too. And then we have social stressors. So these are stressors related to relationships and social interactions at work. So generally speaking, incivility, abuse, harassment, those are all stressors. And we know that staff in prisons routinely face intimidation, abuse, they encounter violence, self-harm and suicide. But social stressors also include relationships with colleagues, with managers, with leaders. And there's good evidence that leadership styles and the behaviour of leaders are linked to stress levels of staff and conversely to well-being. Now, there's also a distinct stressor for those in helping professions, like people who work in prisons, and that's emotional labour. So this is having to routinely repress or display certain emotions alongside the use of empathy. And that can lead to compassion fatigue. So that's the emotional and the physical exhaustion, which can result from absorbing the emotional stress of others, which can make it difficult to empathise and care for people. And it can also lead to burnout, which is the term for when people become emotionally exhausted as a result of experiencing excessive and extended periods of stress. And burnout's characterised by depersonalisation, by becoming more cynical and impersonal in interactions with others, and also by reductions in feelings of personal accomplishment, so doubting the worth of what you do. A recent review of research into emotional labour in probation officers highlighted that surface acting was particularly problematic. So this is when people have to simulate an emotion to fulfil expectations of their professional role. So when someone has to display feelings that they aren't experiencing, and that's linked to burnout. And in addition, prison and probation officers and other frontline staff also have to manage their fear of victimisation. So when you're working in an unpredictable environment, you have to suppress or mask that fear in order to fulfil the obligations of your professional role and what's expected of you. And it's also the case, though, that jobs that involve emotional labour have real benefits, and that includes things like a high level of job satisfaction, because these are jobs that matter, that have a real world impact, they have meaning and value, and doing tasks that have real world significance, which feel meaningful and help provide a sense of purpose, is linked to greater well-being and less strain, which is something that we'll come back to. Now, stressors are present in life, in and out of work. They're a fact of life. But it isn't inevitable that they lead to strain. So strain here is a strain on people's mental and physical resources, which leads to poor mood and can impact negatively on health. We can, and we do, recover from stressors. And recovery is when energy is replenished and we experience more positive emotions. So if we acknowledge that prison staff work in conditions that are characterised by key work-related stressors, that have the potential to do harm, that have the potential to cause strain, there are two important questions. So the first is, how can we protect staff from that potential harm? So what can we do to reduce those stressors? The second question is, how can we encourage recovery? So how do we reduce the impact of the stressors that remain? Because some will always remain.
So Georgia's now talked through the fact that there are multiple stressors, including those environmental stressors, task-related stressors, role-related stressors, and social stressors, which all influence the well-being or have the capacity to influence the well-being of prison staff. And one way of determining what we can do is to look at an approach put forward by the World Health Organization back in 2022. And that's the model presented here on the slide. And this approach suggests that we need to look at three different areas or three types of strategies to protect, to care for the well-being of our staff. The first of these is around prevention. So what can we do to prevent the harm that might be caused? The second is around protecting and promoting well-being. And the third is about supporting those people, those staff in need, so that they can participate in work and they can thrive at work. So we'll now present evidence-based strategies based on these three areas. So the first is prevent. So in applying this model to prisons, first we need to think about how we prevent and address the causes of stress and burnout amongst prison staff. There's a really good Desmond Tutu quote which exemplifies this really well. He said, "We need to stop just pulling people out of the river. Some of us need to go upstream and find out why they are falling in." So that is, we really need to stop waiting for people to become unwell and start addressing those factors which are causing them to become stressed and unwell in the first place. So it's about being proactive rather than just reactive. So what can we do to prevent harm to well-being? The evidence suggests that there's 5 key areas that we could focus on, but this list isn't exhaustive. The first of these is around environment and culture. So the research evidence is clear that the culture of a prison has a significant impact on not only prisoner well-being, but staff well-being too. When we talk about culture, we are talking about the atmosphere and environment we create around ourselves, the way things are done, the way we treat each other, the relationships we have, the physical environment, and everyday practices and behaviours. And if we create a more positive culture, we can improve the well-being of staff. So in a more positive culture, staff would feel valued, staff would feel treated fairly, staff would feel that they are listened to and cared for, they would feel empowered, they would feel that the processes are enabling, and they would feel that there is collaboration. So a prevent strategy is thinking about how we can improve the environment and the culture. Reducing violence and aggression and drug use, so improving the safety of the environment, will certainly help. These things like violence, aggression and drug use have an impact on the actual and perceived threats faced by prison officers and prison staff. We also know that improving the physical environment can help too. So research shows that overcrowding, that poor prison conditions and lots of noise, for example, can result in a range of negative outcomes for staff. So tackling these issues can help look after prison staff's wellbeing. There was some research published quite recently by Helen Nichols based on interviews with over 60 prison managers. And this research suggested that there was a real culture of masculinity amongst prison management, defined as the masculinity contest culture. And that was defined as people feeling, or managers feeling, that they weren't able to show weakness, feeling that instead that they have to show strength and stamina, feeling that they need to put work first, and kind of being in that dog eat dog environment. And that culture was linked to a perception that accessing wellbeing support could have a negative impact on reputation and potentially be career destroying. And that support services seemed to be tokenistic, and people described coming to work even though they were unwell and working excessively long hours. So as well as having a detrimental impact on leaders themselves, that sort of masculinity culture very likely impacts on prison officers too. So to prevent stress and burnout resulting from that kind of culture, we can do things like normalising help-seeking behaviours and emphasising care. We conducted some in-depth research at a prison a few years ago, which had undergone a significant shift in its culture. So it really changed, the culture became much more positive. And we found that there was, in that prison, there was a real emphasis on care for staff across the whole prison. And that was even, and to the prisoners, that care was like integrated into the vision of the prison, which was be honest, be kind, be fair. So that caring was really evident in that prison that had had this positive culture shift. Leadership behaviour is also really important. So across critical occupations, leaders that actively promote and support employee health by meeting basic needs, by talking about wellbeing, and by modelling themselves looking after their own wellbeing, that can really help improve resilience amongst the rest of the staffing group. So if we have leaders who set a clear vision, leaders who empower, leaders who listen to their staff, who care about their staff, are much more likely to have staff with better levels of well-being. Therefore, recruiting the right leaders, as well as training leadership teams to exhibit these kinds of skills, could help prevent issues with staff well-being. There's also really strong evidence that how people feel treated by those in authority can have a big impact on wellbeing at work. So this relates to procedural justice, and we also conducted some large-scale research across prisons in England and Wales, which found that procedural justice matters for prison staff. So that is when staff feel treated in a fair and a just way by leaders and by their managers. That is then related to their levels of stress. So they have lower levels of stress, lower levels of sickness absence and job burnout. They have more commitment to the organisation, better life and job satisfaction, improved well-being, and they were less likely to want to leave their job. Therefore, we can prevent issues in staff well-being by making sure that we treat employees in a fair and just way. The third prevent strategy is around recruitment practices. So a further key way to prevent harm is by ensuring that those people who end up doing the job have the right skills and characteristics, and that people have the right support available to them to enable them to do well in the job. So important questions are how we attract and select people to the service. Are there also ways we can use the information we obtain through the recruitment and selection process to tailor support packages for staff? I came across some research last year at a conference, which was really fascinating. I don't think it's been published yet, but it was really interesting study around a screening process that was conducted in across 3 police forces. So what they did is they assessed they trialed an assessment process for their staff around mental health. And what they found is when assessing the workforce across these 3 police forces, they found that around 80% of staff were typically well, around 15% had some troubling symptoms around well-being, and 5% typically had clinical symptoms which required treatment. So the assessment process that they trialled enabled that organisation to refer those 15% with troubling symptoms to a therapist and onward according to their need. And the top 5% were referred directly to the NHS for treatment. So this screening approach was found to be cost effective in terms of the staffing body's ability to work and in also minimising sickness rates amongst the staff. They talked about something like a 190% return of investment for the programme. So it was they did some fancy economic analysis, but they really found that this was beneficial by having this screening process. It was really beneficial in getting the people who needed support to have that support, and then thereby reducing staff sickness and improving the capacity of staff to perform their duties. The 4th prevent strategy that I want to talk about is related to the support that we provide staff, just the general support that we can provide to people. If we give people the right support, we can prevent or at least reduce the chances of issues occurring for them. So research with prison officers tells us that staff really value peer support, whether that is informal or formal. Having a shared identity at work, feeling in it together and looking out for each other makes an important difference to the well-being of people who work in critical occupations generally, but also amongst prison staff. Peer support can really help to reduce feelings of loneliness and provide access to social, emotional and practical support for staff. Protected space and protected time to talk about issues is also really important. So studies from the US, but also the UK, indicate that as well as feeling part of a larger supportive network, having this protective space in which to talk about the emotional demands of the work with other colleagues is really valued by people working in prisons. And this can be in the form of supervision, it can be in the form of time and space with line managers, or it can be clinical supervision, and these things have been linked to less stress and anxiety and better job satisfaction. And line management is also really important. So line managers can act as an important buffer for people, an important buffer to stress for people working in high threat environments. So regular contact with a line manager who is compassionate, who understands your strengths, who understands your capabilities, but also can provide feedback to you, that can make a real difference to staff. Line managers should have the training and support they need to do this important job well and to help them model that well-being is a priority. And they also play an important role in creating conditions under which people are more likely to detach from work. So having time when people are fully immersed in non-work related thinking, or during which time thoughts about work are not threatening. And that is strongly related to recovery from work stresses, enabling some flexibility in working and avoiding asking people to think about work-related tasks in non-work time, and limiting overtime to protect time for one non-work related activity can really help. And the final prevent strategy is around job demands and job control. So one of the clear findings from the evidence is that a key preventative strategy is focusing on better managing staff workloads, which combines looking at the demands on people's time, while at the same time looking at the level of control people have over the way they manage their time and tasks. So job control helps mitigate the impact of high workloads on stress. So people feeling empowered and people feeling like they have the autonomy in the roles can help prevent harm. And this involves achieving good and stable staffing levels, which rests on recruitment and retention, which I talked about previously. But there are other evidence-informed strategies that are relevant here, including greater levels or greater use of job crafting and also prototyping. So job crafting is initiated by the employees themselves, and it consists of actively modifying the way people do the tasks, who they work with and how they relate to people at work, and their perception of work. So employees balance job demands and resources with personal abilities and needs, which results in increased satisfaction and reduces that risk of burnout, and also increases performance and productivity. So a recent study that was conducted in Poland with prison officers, which was a really interesting study, found that those who engaged in job crafting felt their work was more meaningful and more engaging. And finally, prototyping. So prototyping involves looking at how tasks are performed and testing new ways of doing things to improve outcomes. So there was some research conducted at Exeter Prison last year to explore how methods of prototyping could improve outcomes and better streamline processes and systems. And the key to prototyping really is that it harnesses the insights of and it works with the people who are doing the job in a way that enables people to fail quickly, to learn from that and to adapt, to refine and try again. And it's a real iterative process. And the prototyping in Exeter really emphasised the importance of empowering staff and job control as well. Thanks, Georgia.
Unmute. So then we move into the second set of strategies. So this is protect and promote, which are also proactive strategies. And they're about making sure, as best we can, that people have the right skills, the right knowledge and the right resources to protect and promote well-being. So to protect mental health, the World Health Organization, WHO, recommends three things. Manager training for mental health, which helps managers to recognise and respond to staff who are experiencing emotional distress. And that builds into personal skills like open communication and active listening, and it aims to foster better understanding of how job stressors can affect mental health and can be managed. Then there's training for workers in mental health literacy and awareness, and that aims to improve knowledge of mental health to reduce stigma that can affect how people deal with mental health conditions at work. And then there are interventions for individuals to build skills to manage stress and reduce mental health symptoms, including what we call psychosocial interventions and opportunities for leisure-based physical activity. Now, most prisons have a wide range of individual interventions that are available to staff and managers. So these include things like support from mental health allies, the trauma and risk management intervention, TRIM, care teams. There's cognitive behavioural therapy for sleep issues. There's one-to-one counselling through occupational health. There's lots of different things on offer. So one of the tasks then is to promote use of these. And here we can take an evidence-based approach by turning to behavioural science. So that tells us that if we want people to engage in behaviour that's good for their health, we need to make it as easy as possible for them to do it. So we need to try to reduce any friction that might interfere with pursuing that course of action. And there are a number of issues, a number of points of friction that can get in the way of using the services that organisations offer. So for some people, it's a capability issue. So they don't have the knowledge, so they're not aware of the services or maybe of their eligibility for those services. For others, the sheer size of the offer might just be completely overwhelming. For others, there might be practical barriers. So they might want to access the services, but struggle to get the opportunity to do so. So they might not have the time, or maybe they don't even have the time to find out how you access those services. And then another issue is motivation, and that can be affected by fear of negative repercussions and the stigma associated with accessing support. So research in prisons tells us that they can be places in which help seeking and talking about well-being or mental health isn't the norm. And Helen mentioned some recent research on this issue. Now, I was at a prison last year where I spoke to a prison officer who'd been over 30 years in service, and he was really open with me about his struggles with mental health. Now, he spoke incredibly highly of the care team at that jail, but in the same breath, he also said that he would never go to them for support. And it wasn't because he didn't think that they were competent, quite the opposite. He thought they were really good at their jobs. But he said he knew that the minute he went to see them, that everyone in the jail would know, because it was a public act. People see and people talk, and it's really difficult to keep anything private in a prison. And he was a private and a proud man, and he felt shame about needing help. And that officer wasn't a one-off. So research tells us time and time again that the culture in prisons, that the stigma associated with mental health issues gets in the way of people getting the help that they need. So if we want to protect and promote well-being, to get staff in prisons to use what can be an incredible range of services available, then we really need to work on addressing stigma. We need to work on normalising, reinforcing, or even celebrating looking after well-being and mental health as the responsible and the professional thing to do. The final set of strategies is centred on supporting those who have mental health difficulties to thrive at work. So people living with mental health conditions have the right to participate in work fully and fairly. And WHO recommends 3 interventions to support people with mental health conditions to gain, to sustain and to participate in work. So the first is reasonable accommodations. So reasonable accommodations at work adapt the working conditions to the capacities, to the needs, to the preferences of a worker with a mental health condition. So it might include things like giving people flexible working hours, extra time to complete tasks, modified assignments to reduce stress, time off for health appointments, or regular supportive meetings with supervisors. Then you've got return to work programmes. So these combine work-directed care, like reasonable accommodations or maybe phased re-entry to work, with ongoing clinical care to support workers in meaningfully returning to work after an absence associated with a mental health condition, whilst also reducing mental health symptoms. And then the third strategy is supported employment initiatives. So these help people with severe mental health conditions to maintain their time in work and to continue to provide mental health and vocational support at the same time. Then there are also formal structured interventions for wellbeing. So there was a recent meta-analysis of wellbeing interventions for prison officers, which concluded that there just isn't enough good research to tell us what wellbeing programmes work to reduce stress or manage mental health for frontline prison staff. And the same is true of interventions for people in other critical occupations. So we really need to do more work to build the evidence base here. But as we've mentioned, there are studies with prison officers which point to a few practices and psychological factors that are associated with better wellbeing for people working in prisons. And that includes peer support, it includes line management or supervision. It also includes access to the right equipment, the right training, the right feedback to enable people to do a meaningful job well. Because support for wellbeing at work isn't just about attending to mental or physical health. It's about making sure people have what they need to be of value, to have the right resources, the right knowledge, the right skills, the right ongoing accommodations and support to learn and to improve through supervision, through management, through feedback. And really, underpinning all of this, which is a kind of organising principle, if you will, is making sure that people know that they matter. So mattering can be defined as the extent to which someone is acknowledged, relied upon and valued by others. And people working in prisons need to understand why their job matters. They need to know why what they're being asked to do matters. And it's important that they know that their efforts are seen, that they are valued, and that what they experience at work matters, that they as a human being in that situation matter. And here the scientific evidence is really clear. So as human beings, having a sense of meaning and purpose, having a sense of mattering is vital for our well-being and for better mental health. So knowing that we play a role in our work community, or having somebody looking out for us, or having someone looking to us for help, all of that can provide us with a sense that we matter. And another really simple way of doing this is by explicitly recognising the realities and the challenges of the working environment and the job, by recognising and shining attention on particular behaviours or examples of good work by individuals or teams, which can improve well-being by validating people's hard work, and also by emphasising that their work is important. We can encourage people to see and reflect on the good that they're doing, which can really help.
And finally, linked to mattering, actually, research suggests that it's really not effective to impose support just from the top down. So evidence suggests it's really important that we work with staff to design and to deliver a range of support services that responds to and meets their needs. So less doing to, more doing with, and working collaboratively to ensure that services are fit for purpose, and to ensure that services feel relevant and credible to staff and meet the diverse needs of the prison officers. It's important that people feel that the offer of support is authentic, and that people feel that they could feasibly access that support if they needed to. We can also use participatory methods, which means giving staff a voice and leveraging their experience and their insight, because we know that this can reduce stress. The research that I mentioned previously around culture change in prison, one of the key findings from that research was that encouragement of voice and engagement from staff was a key mechanism of change. And we also conducted some action research in 2 prisons a few years ago, also looking at kind of culture change, where we worked with a group of motivated staff and prisoners to work towards improving the culture at 2 prisons. And one of the key learning points from that study was really how valuable the people involved felt that the project had been for them personally, and the kind of positive impact it had on their own well-being, which was really good to see. So involving staff collaboratively can really help. So to summarise what we've covered, working in prisons and criminal justice presents unique challenges because the environment is inherently high risk. Staff are not only managing security concerns, but they're also navigating complex interpersonal dynamics and performing emotionally demanding tasks. And these pressures can have a significant impact on well-being if they're not addressed proactively. But, as Georgia mentioned right at the beginning, a negative effect on well-being is not inevitable, and there are things that we can do to support staff. The evidence is really clear that if we focus on well-being, we can improve outcomes, including reducing staff sickness, reducing job burnout, increasing staff performance, promoting efficiencies, and increasing cost effectiveness. But we need a structured approach to do this. And what we presented today suggests we should focus on 3 different areas. First is around prevent. So prevention is key. This means looking at the workplace, identifying risks before they escalate, whether that's through improving physical conditions or reducing people's exposure to harmful stressors. Second, it's about building resilience and awareness. When staff can recognise early signs of strain and feel empowered to act, we can create a culture that promotes well-being rather than just being reactive to problems. And finally, support is really essential. So people need to feel like they have the resources and backing to thrive, not just survive. And that could include peer networks, it could include access to mental health services or flexible policies that make it easier to balance those demands. So together, these 3 elements, prevent, protect and promote and support, form a comprehensive strategy for safeguarding staff well-being in such a challenging environment as prisons. Because we know that staff in prisons are doing an incredibly important job, and their well-being is incredibly important too.
And then there'll be a little bit of time for any questions if anyone has any at the end. So first of all, thank you so much for coming today. We just wanted to kind of leave with a few things, a few sort of takeaway messages, I guess, which is, first of all, that the evidence from the research, from people who are doing the work, from stakeholders, from organisational data, it all tells us that prisons are a challenging work environment, that they contain lots of stressors, but that they're also places where people do incredibly important and valuable work, and where staff can make a genuine difference. And we know that being in a job that feels meaningful, that provides a sense of purpose and belonging, and actually in which you can really see the difference that you're making and the value that you add, that is all linked to better well-being and the ability to tolerate and recover from stress too. We can use an evidence-based approach to well-being, so we can focus on what we can do to prevent harm, to protect staff by monitoring and improving conditions for well-being at work, to promote staff support services, to support our staff to do a good job well through those reasonable accommodations, effective line management, development work, working collaboratively to produce support services that are accessible, that are practical, that meet staff needs. We also wanted to highlight that it's those administrative level solutions, the things like improving prison culture, ensuring good communication, communicating and exercising authority in a procedurally just way, providing recognition for staff who are doing a good job, involving staff in decision making. Those things are just as important, if not more so, than the specific individual level wellbeing services and interventions. And then finally, if we want to make a difference to wellbeing, we should really commit to making sure that every member of staff in prisons knows that they matter and that the work that they do matters. So thank you for joining us. And we've got a